austerity, spiraling debt and vaccine inequity will bring inequality crisis in West Africa to levels never reached before. This is according to a new report by Oxfam. The report has singled out Nigeria as the worst performing West African country when it comes to tackling inequality going into the pandemic. Oxfam's commitment to reducing inequality index shows that 14 out of 16 West African nations intend to cut their national budgets by a combined total of $26.8 billion over the next 5 years, all in an effort to make up for the $48.7 billion that were lost in 2020 due to the COVID-19 pandemic. Now, the report also scored Sierra Leone low on its index of countries committed to reducing inequality in Africa and has warned that any massive cut on public finances could push millions more West Africans into poverty as well as hunger. Well, for more on this report, we're now joined by Kwesi Obeng, the West Africa Regional Programme Advisor on Inequality for Oxfam International, and he joins us from Accra. Thank you so much indeed for joining us. Welcome to the programme.
Thank you, Peter.
Tell us a bit more about the report. What were you trying to measure? What were you trying to look at before we go into the findings?
Well, so barely 6 months before COVID hit, in March, we published a first report in which we indicated the data showed that West African citizens were living under governments that were the least committed to tackling inequality. And we sounded the alarm on the fact that social public spending, particularly on issues like education, healthcare, and social protection, were the least across Africa when you compare West Africa to North, Southern Africa, Central Africa. It was the least. And so we issued a warning indicating that West African leaders were not prioritizing the fight against inequality and poverty. And of course, 6 months down the line, we ran into COVID. And so during COVID, we saw quite an aggressive approach to address some of the gaps we saw. So, we saw kind of a hike in social or public spending, particularly around health for obvious reasons, and then some type of social protection. But since we kind of moved into the third phase of the wave, we've seen government roll back some of the minimal, interventions they put in place. Instead, they've ushered in about the worst austerity measures the region has seen in over a generation. Of course, there is a background to it. In 2020, during the COVID, the region lost close to $45 billion, nearly $50 billion in terms of the economics, economic losses, and the equivalent of 7 million jobs because of the precarious nature of many of the jobs, and also the absence of any protection for workers, particularly women. And so to plug this hole, the governments in the region in the next 5 years, between 2022 and 2026, are planning to cut a minimum of $26.8 billion. Now, if you just quote that, it doesn't give a sense of what this means. But this could actually provide about 600 modern, well-equipped hospitals, for example, and millions of people with social protection, as well as over 71 million kids back in school, or 7.1 million kids in school for the next 10 years. So the cut is huge. And in fact, we just looked at the latest numbers published by the IMF. They published it just last Tuesday, the World Economic Outlook. The cuts are even deeper. They are nearly $70 billion. So it is huge. But I think I'll take a step back to also give you a sense of the character of the crisis in the region. West Africa, in terms of public services, for example, it's doing just about a quarter of what Southern Africa is doing. And in terms of labor rights, particularly minimum wage protection for women and unions is doing just about a fifth of what Southern Africa does. So the gap between what West Africans are doing and the rest of Africa is huge. And we think that the region and the governments in the region have the scope and capacity to be able to actually rein in inequality. And don't forget also, this region faces some of the severest hunger crisis on the continent.
Why would it be that the region is underspending as compared to their counterparts in other parts of the continent? What's going on? Are we talking about mismanagement or just a lack of understanding of the kind of social spending that is critically important?
So the thing about it is that from our evidence, there are two main factors. One is tackling inequality. It's not providence. It's actually a political will. And the leaders have to make the political decision to invest the resources they need. Now, that political will is non-existent. And worst of all, we're seeing this, as I said, this massive raid on public finance, essentially encouraged by the IMF, and which is really a playbook of the 80s, of the austerity, the structural adjustment days of fiscal consolidation. In other words, basically taking money to balance the books, never mind the consequences on citizens. And I must also indicate that the region spends close to 60% of government revenue in servicing debt. So you have actually a bizarre concoction of three key factors. One is the austerity, literally austerity on steroids, that is essentially encouraged by the IMF. And then you also have debt out of control. And then on top of that, you also have this vaccine crisis or vaccine nationalism. So you have these three factors forming a potent concoction that, by all accounts, will push the region to its worst, inequality crisis in over a generation. And so that is the nature of it. I think the fundamental thing is that the governments have not shown a commitment to tackle that. But let me quickly point out that a couple of governments are making the right decisions. So if you take a country like Burkina Faso, the country spends about 23%, 3 points above the African Union target of 20%. And that puts Burkina Faso about the ninth best country in the world in terms of the quantum of its budget it allocates to education. And if you take another country, a country like Cape Verde, up to 85% of people of pensionable age have pension. On the average in West Africa, it's only about 15% of the citizens. So what we're seeing is that the most vulnerable in our society have no safety net. And that they're living pretty much precarious lives. And no wonder when COVID hit, it hit the citizens so badly to the extent that we lost, as I said earlier, up to 7 million jobs. And I just give you another, in terms of health, according to the Abuja Declaration, again, under AU, countries are supposed to spend a minimum of 15% of their national budget on health. On the average, West African governments are spending just about 7.7%. And on social protection, West African governments are spending just about 6.5% of the 20% of their national budget that is supposed to be invested. So it points to the fact that the governments have not shown the political will to invest their resources where it would benefit most of their citizens. And just one last point I might have to add. During the same period, in fact, of COVID, in the first 17 months, just 3 of the wealthiest men had their wealth expand by $6.4 billion. That is enough to provide vaccination, full vaccination for all citizens, all 300 plus million citizens of West Africa. So you have this very regressive tax policies, a lot of incentives for corporations, and very minimal investment in social protection. So I think that essentially it's down to government's lack of will to invest their resources where it would benefit most of their citizens.
And your report points to Nigeria as perhaps the biggest culprit. What is it about Nigeria? I mean, this country is one of the largest oil producers in the world. One would think with the resources that the country has that they would be near the top of fighting inequality.
Well, the Nigerian case is a tragedy, a travesty, to say the least. The global index that Oxfam constructed, Nigeria came only above South Sudan. The global index is made up of 158 countries, and Nigeria came, 157th. In West Africa and in Africa, it's the least committed. Remember, in the middle of the crisis, the federal government of Nigeria slashed its health and education budget. Who does that? By middle of 2020, the government slashed it, its budget. That shows you, the lack of priority. As we speak, over 10 million kids, Nigerian children, are out of school. This was before COVID, and so the numbers would have gone up. And the World Bank projects that since in 2012, actually, about 6 million more people have fallen into extreme poverty in West Africa, most of them in Nigeria. And again, we've seen, encouraged by the IMF, this year, the federal government has raised its VAT from 5 to 7%, and there are projections to raise it to about 12.5%. VAT, as we know, is a consumption tax. And since COVID, Nigerians have seen a spike in just basic commodities, including food and medicine, because the VAT in Nigeria, unlike a place like Ghana, does not exempt essential services, essential products like medicine and food. And so the ordinary citizen who has lost his job is the one having to bear the brunt of these very atrocious economic policies being implemented by the federal government. And so I think it comes back to the same point. It's just a demonstration of a lack of commitment to address the fundamental needs of the majority of the citizens. And it's no surprise that, the country continues to see all this, civil strife. So that is, and also don't forget that Nigeria's oil wealth really is controlled by a tiny elite. It does not spread. And you would have thought that in the middle of this crisis, the resources would have been invested in providing some cushion for the citizens, but no. The corporations are the ones benefiting, and the tiny political elites. So that is the crisis we have in Nigeria, and from what we see, we don't see any change in the direction of the policy, particularly with all the encouragement of austerity by the IMF.
Kwesi, we're going to have to leave it there, but thank you so much indeed for sharing the insights in this report. Alarming, but one hopes that the more it's heard, that perhaps the authorities concerned can do something to improve the lives of people on the ground. Thank you so much indeed. Medasi.
Yeah, thank you for having me.
All right. That's Kwesi Obeng from West Africa, Oxfam, talking about the alarming rates of inequality, particularly in that region. And COVID-19 has just made things worse, and they're seeing inequality they have never seen before in the region. And the number one culprit, unfortunately, is Nigeria.